I'm Dr. Kevin Kaplan from the Jacksonville Orthopedic Institute and head team physician for the Jacksonville Jaguars. I'm here at the JCA, Jewish Community Alliance, giving a talk about shoulder injuries, shoulder symptoms, and how we treat them. The goal of the talk is to define the basic anatomy of the shoulder, bring it down to a level that patients can understand, and go over the different signs and symptoms of shoulder pain, the different diagnoses that I see in my office, and how I treat them. But rotator cuffs that are symptomatic may need surgery, may need therapy, and we may need to treat them. But why do rotator cuffs tear in the first place? There are different theories. One is that it's an extrinsic problem. The same analogy that I said about the rope fraying or pushing on. If you have a little bone spur in your shoulder and you do this over and over again, that rotator cuff tendon can rub on that bone spur, and that can cause an impingement, and that can then cause a little tearing that then develops into a full-blown tear. As we all get older, our tendons will degenerate a little bit, and that can also, because of the poor vascular flow to this area, to this rotator cuff, that can also, when it gets a little bit worn down and you've used it your entire life, that can also predispose a rotator cuff to tear. But in reality, there's not one thing. A lot of people ask me, why did this happen? I can't give them one specific reason. I can only say these are probably the reasons why it happened, but usually it's multifactorial in nature. Most patients with rotator cuff tears will complain their first. I love when patients come in and they say, I don't have a rotator cuff tear, I know it. And I say, how do you know you don't have a rotator cuff tear? Because I got pain right there and I know my rotator cuff's up here. But actually the number one place where patients complain of shoulder pain, whether it's your rotator cuff or your labrum, it refers right to where your deltoid is. So right in your arm over here. Patient number 2. All right. So, night pain is another common symptom that patients complain about. And why is that? Well, you're using your shoulder during the day, it may be warmed up, and then when you go to sit down and let your shoulder relax, you may really start feeling the pain from that rotator cuff. Difficulty sleeping on the affected shoulder, like I talked about. Pain with overhead activities. Pain may radiate, but usually the radiation stops near the elbow. Pain that goes past the elbow into the hand makes me think again more about the cervical spine and the neck. So again, when I look for a rotator cuff tear, I have to make a diagnosis, so usually I'll send patients for an MRI, and this is an example of an MRI of one of my patients. Here's the ball that we talked about. Here's the socket. This black area here is the rotator cuff muscle, which then turns into a tendon, and the tendon then is supposed to insert into the bone. This is the wide rotator cuff footprint that we were talking about, so it's not just one point. This is the rotator cuff footprint. That tendon belongs on that bone. So this is a full thickness tear of the rotator cuff that's popped off the bone. And you can imagine if it's a big enough tear, when that muscle tries to fire, if it's not attached and that suspension bridge is broken and you try to lift it up, patients will come in and they'll try to hike their shoulder, cheat, and they'll try to bring their shoulder up because they can't get that abduction. The deltoid, the big muscle group around the shoulder, may still work, but they have difficulty really getting that strength and bringing their arm up. So you have symptoms of shoulder pain and you need more information, come visit us online, joi.net. You can see me at my website, www.kevinkaplanmd.com, to learn more about the shoulder. If you have symptoms that don't go away, pain at night, pain when you lift your arm over your head, clicking, popping, come and see us at JOI. We'll be happy to help.